mechanism of the injury?
The car is the driver collide with the tree.
Okay, so the patient is with you now?
Yes, yes.
How is the patient's condition? Tell me about his airway. Can you talk to him with clear voice?
He just respond to call.
Okay, how is the vital sign?
By the time the BP is 90 over 40, the
Okay.
RP is 130.
Okay, SpO2?
SpO2 is 92.
Okay, any bleeding from the external that you can see of?
I cannot see anything.
Okay, any impure object, foreign body on the chest, abdomen,
I don't
limbs?
think so.
Okay, so what treatment have you initiated so far?
I just put a blanket on top of the patient.
Okay, I want you to do the following things. Listen, first, put the patient on the high flow mask oxygen. Okay, put the patient on the cervical collar. If you see any bleeding, compress it with the compression bandage. Okay, and then I want you to insert 2 large probe radula, infuse 1 liter of the warm saline as soon as you get the line in. Okay, are you clear with my instructions?
Yes.
Any other casualty at the same time?
I don't think it's only one.
When is your ETA?
88, 5 minutes time.
Okay, when you arrive to ED, send the patient to red zone immediately.
Okay.
Okay, kids. We are going to have the case FBA, a young driver, okay, collided with the tree. Okay, so I will be the team leader today for the patient. Amina?
Yes,
team leader. The airway. When the patient comes, I want you to open the airway to the suction, put the high flow oxygen in the way indicated.
Yes, leader.
Okay, my role.
Yes,
you are
leader.
the circulation 1 today. So I want you to insert 2 large from Madula when patient arrives, then the plug for the FBC, RP, CONACT, GSM, 4-5 cross match, SBT, and also DXT.
Yes,
Put the
leader.
patient on 1 liter warm saline once you get the line in. And prepare as many as possible.
Yes, leader.
Okay, Akbar, you are in charge of the vital sign and medication. I want you to put the patient on the cardiac monitor as soon as possible. And also get the vital sign for me.
Yes,
So, you are the
leader.
runner of the day. And patient up, please prepare the vital collar, get ready the bed, and then also the ultrasound machine, and also immobilizer. Okay?
Yes,
When
leader.
you are in the station, check your equipment respectively. Make sure it's functioning. Make sure you wear the PPE properly. Okay. Kids, are you clear with my instruction?
Yes, leader.
Okay, let's come. Okay. Bob, get a second caller A. Pravina?
Yes, leader. Yeah.
Any foreign body in the order A?
Foreign body here.
No, any foreign body in the
No
order
foreign
A?
body seen.
Okay, patient talking with the clear boy.
Cervical collar ready.
Okay, not on the okay. You know, enough stimulation. Put the cervical collar A. Okay.
Okey bang, kita nak cucuk jarum sikit. Okey, bantal sikit lah.
Okay, put the patient on high flow mask oxygen. Connect to 15 liters oxygen now. Okay, what are the vital signs? SpO2,
SpO2 improved to 94% under
BP?
BP is 110 over 70.
heart rate.
Heart rate is 130.
Okay. Okay, Alma, make sure you get the practical for the blood bank, get the 6 month after version. Yeah?
Now you notice the patient is more tachypneic.
Okay, patient is quoting more tachypneic. Okay. Hello,
They
sir.
expect to
Hello,
drop
sir.
to-
Okay, patient is no longer responding to me.
94%.
Okay.
Cucuk
Guys,
sikit.
this patient is become more drowsy. We need to intubate the patient for the airway protection now. Akma, I want you to prepare the medication. We are going to intubate the patient using the rapid sequence intubation. Get ready the IV fentanyl 100 microgram, IV intermediate 20 milligram, IV scoring 100 milligram. When you're ready, let me know.
Yes, leader.
Hi, Ro, I want you to prepare the intubation equipment.
Yes,
Get ready
leader.
the intubation equipment. PDD size 7.5, one size smaller, one size larger, and also get the deflected airway for this standby.
Yes, leader.
Bob, I want you to be in charge of manual inlet stabilization during the intubation.
Yes, leader.
Babina, have you read the patient, Babina?
Yes, I'm ready to intubate the patient. 80%.
Okay. Clear suction. Okay, and patient.
Leader, medication ready?
Okay.
Okay, I pre-oxygenated the patient with 15
Okay,
liters
Babina,
oxygen.
continue with the pre-oxygenation. How's
Okay,
SpO2?
leader.
It's not here.
Okay.
Maybe around 80.
Akma, are you ready with the medication?
Yes, I'm ready.
Okay, please give the medication now.
Okay, 10 leader.
Okay, get ready.
Intubation set is ready.
Okay, IV fentanyl 100 mg given. IV intermediate 200 mg given. Scoring 100 mg given.
Okay, thank you, Akma. Okay. Guys, are you okay? Babina, are you ready for intubation? You want to raise the bed? Okay, raise the bed.
Raise the bed a bit.
Maintain the inline stabilization. Okay. Get the deflected airway for standby.
Yes,
Ready?
standby.
Everything standby. Can we see the vocal cord?
Yes, EKG. Okay, can I have the EKG please? Okay, EKG.
Pravina, connect the patient to the manometer. Let me know the PTCO2 once you get the reading. Okay, meantime I need to check the entry.
Okay, I've already connected to the PECO2 capnometer here.
How is the entry?
Entry reduced on the left side.
Okay, how is the SpO2 now?
SpO2 is maintaining around 90.
Okay, Pravina, how many cm you anchor?
It's anchored at 18.
Okay, you should be okay. I need to assess the breathing. This patient having other injury at the same time. Okay, okay, anchor the thing. Put on the cervical collar now. How is it? Okay, good. How is the trachea? Is it deviated?
Trachea is deviated to the right side.
Okay, any distended neck vein can be seen?
Yes, this is distended neck vein seen.
Okay, holding the chest. How is the chest right?
There's a reduce in the chest wall rise on the left side.
Any organ sucking chest movements in?
There's no sucking.
Any paradoxical chest movements in?
No parasural chest.
How are the percussion notes?
Hyperresonance on the left side.
Okay, the entry.
It reduced on the left side.
How about the heart sound?
Outside is muffled.
Okay, this patient now is having the right tension pneumothorax together with the cardiac tamponade. We need to do two procedures now. One is the pericardiosynthesis, another one is the neurothoracocentesis, and also we need to do the chest tube over the right side. Okay? Okay, now, Cairo, I want you to get ready the neurothoracocentesis equipment. Box, get ready the pericardiosynthesis. Give me the angiocatheter. Get ready the ultrasound machine. I need to do the pericardiosynthesis now. Okay, Ahmad, attach the patient to the cardiac monitor.
Cardiac monitor attached. The saturation is dropping to 80% now.
Okay, neurothoracocentesis,
The BP is dropping to 80 over 40 with the heart rate increase to 160 now.
And just as you go in, another patient comes into your resus cubicle.
Okay. Okay, we need to split into two teams now. Okay. Pravina, you and Bob go and take the second patient now, and you will be the temporary team leader. I will come to you once I settle this patient. Okay? Okay, Cairo, can you please take the patient more and put them in?
Okay.
Neurothoracocentesis in. Okay.
There's no hissing sound.
Is air coming in?
I'll do the inline manual. Bob, can you please give me the cervical collar, cervical collar? Get me a suction catheter and a high flow mask.
Yes, team leader.
Elevated to the right side.
You attempt again. Over the second intercostal space, mix every flow line. Okay, great. Anything coming up?
There's nothing
Can I
coming
have a
out.
Okay.
suction
Any hissing sound after I move the needle?
There's no hissing sound on the right side.
Do the chest tube surgeon now. Get me the chest tube equipment.
Okay, we need to intubate this patient. What's the SpO2 like? Okay, we need to intubate this patient. Bob, can you prepare the intubation set? That means size 7.5 with the
See the SpO2 dropping to 75%.
Anything coming out of the chest tube?
intermediate 20.
There's bubbling, but there's not that much.
Yes, team leader.
That's what I think.
Okay.
Angiocatheter. I need to do a pericardiosynthesis now. Okay, attach the patient to the monitor. Okay, Ahmad, I'm going to hold the ultrasound machine. Okay, I'm going to pericardiosynthesis now. Locate the landmark. Okay, the cardiac monitor. Okay, anchoring needle down, going in. Towards the tip shoulder.
Okay, there's blood coming out.
How much of blood coming up?
10 cc.
I'm continuing withdrawing all the diluted blood until it's dry.
Okay, it's right.
Okay, connect to the catheters and then draining back. Okay, now anchor the suture.
Apa dah jadi dengan anak saya ni? Apa dah jadi ni?
Puan kumpul dekat luar sekejap. Nanti takut ni dah tolong panggil security untuk bawa patient ni ke
Please, someone to help us. Okay, security. Tolong tunggulah kita nak masuk dah. Sabar kan? Sabar.
Yes, there's a chest rise, but reduction in
Any
blood
reduction,
on
any
the left side.
blockage after the OPT, any secretion inside, you need to do a suction.
Do the suction.
Okay, Bob, can you use the manual for the patient? IV fentanyl first,
Okay, Sarita.
intermediate, and then scroll it. Okay? Start line dulu.
How is the trachea now?
Back dulu. Back first. Okay, doctor.
Hyperresonance on the left side.
The spider is getting louder.
Reduce entry on the left side.
Okay, guys. See, this patient is having the left tension motor. Down this. Percussion over the left.
Hyperresonant on the left side.
Okay, patient is having the tension pneumothoracus over the left side. Right? We need to do a thoracocentesis over the left side.
Cucuk sikit je ya.
Okay, is anything coming up?
Yes, there's a hissing sound.
Do a chest tube.
Okey, habis mana lagi
You
bang?
just perform a chest tube over the left side.
Okey, yang mana given? Habis calling given.
So with the hissing sound, the BP pick up to 90/40.
How's the
The heart rate coming down to 140. SpO2 picking up to 90%.
You can't see anything.
Okay.
You have an LMA?
Anything coming up from the chest tube?
Yes, there's a bleeding coming out from the chest.
Any blood?
There's no blood.
Okay. Chest tube. Okay. Now how much of the blood did start? Okay, Ahmad, get the stage 4 blood cell. From the picture put the GSM also. This is urgent now. Okay. How's the circulation? The CRT?
The CRT is prolonged.
How's the color?
The color is pale.
How about the point of it's cold?
Peripheries are cold.
Okay,
Phosphodil is reduced.
okay, how's the BP now?
The BP is 90/40.
How's the heart rate?
Heart rate 130.
Okay, start the patient on the table position.
Okay,
Get the
step
position.
up.
Now,
Team leader.
position.
We have your help.
This one. Okay, Ahmad. Now, I want you to
It's becoming more radical.
check heart rate, is also for bleeding, and then compress it, and then check for the internal force of blood as well.
Okay, Bob, can you try one more line?
Yes.
Yes, go on to the mechanical ventilation, and then after that you assist Ahmad. Okay, I'll be back soon.
BP is unrecordable now. SpO2 is also unrecordable.
Pabita, what's
No,
the
no, the
condition?
I cannot intubate the patient, so I put on the patient on an LMA, and then I can't ventilate the patient. SpO2 is not picking up, the patient is becoming more bradycardia.
We need to prepare the patient for the surgical airway now. Okay? Okay, Bob.
Yes,
you
team
can
leader.
see the surgical airway.
Okay.
Surgical airway now for the patient.
Okey.
Sorry, apa?
Heart rate is 30 now.
Bob, get ready, equipment.
Yes.
Okay, that's already done.
Apa jadi ni? Pada anak saya ni apa jadi ni? Doktor Alor je saya macam tu, tak bagi tahu apa-apa. Terus saya terus anak saya ni.
Tak payah kejap. Saya nak bantu.
Banyak darah keluar.
Apa dah jadi dengan anak saya?
Banyak darah.
Can you chest rise now?
There is bilateral chest rise method.
Okay, heart rate goes up to 140. BP is 90/40, 60/40. SpO2 picking up with the ventilator to 95%.
Kompres kuat lagi. Ada darah keluar lagi.
Okay, Pramina.
Still, ada darah keluar lagi.
Just continue.
Ada keluar darah lagi. So,
Yes,
Continue the
leader.
assessment for the breathing circulation. I'll be back soon in a moment.
Okay. So there's no more bleed, there's no more blood see. How is the
Ahmad, now we know.
Trachea is central.
Is there any distension of the neck vein?
There is bilateral distension of neck vein.
Is there any open wound over the chest?
There is no open wound over the
Is
chest.
there any foreign body? Is there any laceration wound?
There is no open sucking chest wound. There is no what else?
The wound?
There is no laceration wound.
Compress it. Just
How is the chest rise of the patient?
the longest riser. Have you assessed the abdomen? Sir?
The air entry of the patient.
How is the abdomen for the patient?
Apa jadi dah dengan anak saya ni? Apa jadi ni? Apa dah jadi? Anak, jangan risau nak. Apa dah jadi?
Saya doktor kat sini.
Doktor, you tak explain pun apa-apa dengan saya.
Puan, kita akan
Tolong.
Puan, kita akan jaga anak awak. Awak tunggu dekat luar sekejap. Nanti saya akan cakap. Bagi kami masa untuk tengok patient dah. Sekejap. Nanti kita
Dari
akan
tadi
datang.
you Allah saja tak bagi tahu apa-apa pun cik.
Okay, can I have Pupil is right side is 5 reactive, the left side is 3 reactive.
Any the rising signs for this patient? Structural signs rising, the patient moving on this.
Not moving.
Okay, with the 1 liter of normal saline that is going in, his BP is
Okay,
still low.
guys, we need to fully exposure the patient. Make sure any other wounds are not
Yes, there's a bleeding on the spot
compress it.
at the forehead.
Okay, hello.
Okay, safe O is been given to the patient. What is the latest BP?
Okay, his BP is still low.
50/30, heart rate is tachycardic 110. SpO2 is normal.
Excuse me, team leader, I need help here. I already given 1 liter of normal saline, 2 pints of safe O, and the BP is still low, 60/30. I need people to run for GXM now.
Okay, Bob, can you please make Bob is back, is it?
Rob is lagging at the moment.
Okay, Hannah, I
Yes,
want you to
David.
give
40/20 now.
Blood now. Do you have any safe O now at the moment?
I have already given 2 pints safe
Any
O.
more safe O in the department? Just continue with the safe O and then run to the blood bank, get the urgent blood now.
Do you have any more safe O?
Any more safe O?
Take a course.
Yeah, continue the safe O.
Resource is never a problem, huh?
I don't get
This is sponsor safe O.
What's the temperature for this patient?
Temperature is 36.8.
Okay, put the patient under 2 warm blanket, okay? And start the warmer for the patient. Okay, so one more time again. What's the BP now?
BP is 90/40.
How's the heart rate?
Hari Kata to hari 20.
How's the SpO2?
BP is still low.
Okay. Okay, continue with the patient condition. Once you get the urgent
You can't see any evidence of bleeding anywhere.
This time, Amma, I want you to do few things.
Abdomen is soft.
First, insert the oral gastric.
How's the pelvic?
Pelvic is-
Then
pelvic spring is positive.
Get EEG
Over?
for this patient. And also
Bilateral.
You need the urgent
Okay, now we have unstable pelvic injury here. Causing the patient to have hemorrhagic shock. Okay, can we get a pelvic sling for this cause? Can I have the SAM sling or the Nina sling?
Any people had a Morrison and no renal angle?
Morrison Bosch, negative. There's no fluid.
Now,
No missing.
Make sure that the blood is running properly.
Just more collection. The blood is not running properly.
is it causing a tamponade?
Yes, Leader.
Okay, with the blood transfusion, the BP is just sustaining barely 60/40. Heart rate is still tachycardic.
Okay, I want you to continue managing with the first patient as I according to what I told you just now. Okay? And now after this, I want you to call the respective team, this patient. You need to call the urgent cardiothoracic surgeon, then also call the orthopedic surgeon, and unless this patient needs to go to the OT for urgent nephrostomy, so cardiac component, okay? Clear? Are you clear with the instruction?
Yes, here.
Okay. How's the condition?
BP is still lower, on low side.
BP is unrecordable now.
So we're trying to
The heart rate is maintaining 130. BP is 90/40. SpO2 is 95%.
They put on the cardiac
On
monitor.
ventilator. Heart rate 130. Pulse rate, BP 90/40.
Oh, the cardiac monitor.
You see organized rhythm.
Okay. Is pulse still present?
Pulse is barely feeble over the carotid area.
How's the BP now? Is it recordable now?
Still not recordable.
Okay, we need to pump more like this. BP still low? How much? Can you get the urgent first match? Transfer the patient now. And then call the respective team. And then patient needs to go to OT now.
Team leader, we already given 4 pints safe O. Now I'm going to put up another 2 pints of safe O for this patient.
Continue with the patient condition. Okay. Cardiac monitoring. Yes, transfer the patient condition.
You already applied the SAM splint.
Yes.
So with the application of the SAM splint, the BP is still unrecordable.
Okay. So any other source of bleeding? Guys, we need to look out for the source of bleeding now.
There's some bleeding over the scalp. I think we can do some compressive.
Compressive.
BP now coming down to 80/40. Heart rate is 140 and breathing. SpO2 is still maintaining 95.
Yes, team leader.
Okay, so we need to go back to the area again. Is the ATP still functioning?
Yes.
That's right.
No alarm sound.
How is the breathing? When you're back, any chest rise equal?
That's right. Equal.
Chest still functioning?
Sensor both sides functioning.
Okay, got wing.
Okay, the dressing over the scalp is already addressed, but BP is still low.
The dressing soap.
Do we have the
Still unrecordable.
you have the GXM for this patient already?
GXM is ready.
Any more the standard?
The abdomen is not standard.
Okay. Any new hematoma, full reason, noted over the pelvic, the lip, what's the other femur?
No, okay, that's not it.
Okay, the FBC just came back and they said that the hemoglobin is 12.
Because there's excessive bleeding over the pelvic region. So, any other bleeding besides the
Externally,
So how about
do you see any bleeding?
over the scalp?
That has already been addressed.
it's not the open femur fracture, but the dressing is maintained. No stroke.
Can I have the ultrasound now?
There's no free fluid.
Any fluid over the nostril? Over the sphenoidal angle? Over the
Repeat the other side again.
over the
The BP is after
You see a lot of
oh negative, sorry. It's 90 to 40. Coming down to 120. It's right now I have a
Ahmad, get the urgent catch and then call the orthopedic surgeon and cardiothoracic surgeon. Okay? In time, you need to look for any new source of bleeding. If dressing soap, please inform me.
just ready to reach. I'm going to do a very bad sleep round. I'll take the patient to the cardiac now. I have a patient with a cardiac catheter here. Okay, so we need to do a very cardiac surgery. I'm already prepared the instruments.
Do you know how to do it?
I'm not very sure.
Okay, I will do the cardiothoracic for this patient. Okay? Okay, we need the ultrasound.
Ready?
Alright.
The ECG, the still scientific, there's no arrhythmia seen on the screen.
Okay, where's the tips of the shoulder? Any blood coming up?
coming out.
Okay, and the change as much as possible.
Okay, now the BP is 70 over 40, heart rate is 120, SpO2 is 90%, 99%.
Any collections here from the ultrasound? Any collection? Any collections left remnant?
Still got,
Okay. Still can aspirate?
still can aspirate.
Yeah, already given 6 pints of safe O, waiting for the GXM patient.
Okay, now there is resistance, you can aspirate.
Okay, put the patient on the catheter, anchor the suture. Okay, from now.
Currently is 100 over 70. The heart rate is
Okay, anchor.
Pyro, get more of the fat cell for the subject, need urgent more fat cells. Okay? BP is still lowish, we need to get outside the source of bleeding. Abdomen.
There was a pelvic injury here, already put on a spin, there's no external bleeding over the lower limb.
How is the vital sign now after the pericardial synthesis?
Okay, after pericardial synthesis, the blood pressure right now is 90 over 60, heart rate is 100, SpO2 is 99%.
Okay. Okay, Pramina, continue the assessment. I'll be back after this. Back to the first patient.
Okay, thank you. Take me then. Is there any deformity over the left shoulder or the right?
Akma, how's the patient now?
No deformity.
Okay.
Okay, how about the other thing? Breathing, okay. Okay, BP, latest BP is?
latest BP is 100 over 70.
Okay,
Heart rate is 110.
Okay, has a respective team come
Left
ready for
side
this
is
patient?
5 millimeter, right side is 2 millimeter.
Has a respective team come ready?
Oh, she has
Okay, Akma, I want you to call
What do you mean by lateralizing sign?
First, call the cardiothoracic surgeon. Tell him we have a patient of the pneumothorax and also the cardiac pneumonia.
Is there anyone?
Also call the orthopedic surgeon.
Seizures.
Yeah, open right femur.
You see any seizures?
Okay, and also call the anesthesia. Patient is going to OT.
Is there any bleeding
Okay,
from the
you
nasal
inform the respective team.
oral
Okay.
cavity?
Do you see any bleeding from the
I've called the surgeon.
Didn't receive any
Completely with
call.
mine.
I didn't receive any call.
Okay, call the orthopedic surgeon. Hello, Mr. Orthopedic Surgeon. This is
Yes.
Chang, registrar from the Red Zone Casualty.
Yes.
We have a polytrauma case currently in
Okay,
casualty.
coming down now.
What do you want to do now, doctor?
We need to do a lock roll for this patient.
Okay. Any other things? Any
Looking
wound?
for?
Any techniques of it? Quick one. Any wound in the eye and bleeding? Yes.
There's a wound over the right side.
Okay. Nose bleeding, oral cavity. There's a ear bleeding. Okay.
There's the ear bleeding as well.
No. Neck, any more distended emphysema?
The neck distended is reducing.
Chest?
It's not infected.
Team leader, I need to borrow one of your staff. We need to do a lock roll for this patient.
Okay, go ahead. Ongoing.
Ini bagging semua.
Dressing. All the deformity, the wound, everything. Okay, the heart, okay. Okay.
Okay.
Then after that, the pulse.
The pulse is present on the distal bone of the legs.
Is the ventilator available here at the moment?
The ventilator is available.
And then the box can do the lock roll for the patient.
5 more minutes.
there any step deformity over the back?
There is no step deformity.
Is there any abrasion, any laceration over the back?
No.
I'm going to do a DRE for the patient. I'll do a rectal examination. Is there any blood in the rectum?
There is blood in the rectum.
Okay, is there any bony prominence that I can see?
Still ongoing. It's still coming.
Can I feel the prostate?
High riding.
Amina, how is the condition there?
The condition is still under control, Dr. Che. Okay, we can put back the patient now.
On my count. 1, 2, 3.
Okay, team, possibly we are having a patient with a pelvic injury. Causing also a possible hysterectomy. Because there was a blood also in the
I have you?
I want you to continue to monitor the vital sign.
Is there any blood over the urethral nature?
All the adjunct that I told you now. Okay, I'll come back after
So
this.
there is possible of urethral injury of the patient. So, Harold, can you put the patient on condom procedure? Team leader, now we have a cardiac component and also possible intracranial injury.
Okay.
So already intubated the patient, already did the pericardic metastasis, already put the patient on the pelvic plate, already given 6 kind of stage O, already ongoing another 2 kind of stage blood. When we did the rock roll, there was no step deformity, but the inner tube was present, and also there was minimal blood in the rectum with the bony prominence, high riding prostate, and a blood in the uterus.
Okay.
Okay, then. Can indicator is on.
What is the BP pass rate?
60 over 30, 100 is 120.
Okay, yes,
The BP is right now is 60 over 30 with pass rate of 100.
Okay, so Amina, continue with the safe O transfusion now.
Can we have another, already completed with 6 pints of safe O, we already given another 2 pints, so I'm going to give another 2 more pints of the
Okay,
patient's
meantime, any
blood.
source of bleeding, and this now is a drain catheter draining a lot of blood now.
What catheter?
The pericardial synthesis catheter.
Not much.
Any other source of bleeding now for this patient?
Not that you can see.
Okay.
So another 2 more pints of blood.
The scrotal hematoma is getting bigger.
Continue the
Scrotal hematoma is bigger.
continue with the passive transfusion. Call the orthopedic surgeon now. Patient need to go to OT for the emergency department.
And the surgical.
Yes. So please continue with the passive transfusion, safe O transfusion also with this patient. Okay.
Alright.
Get fast as fast.
Okay, team leader, I'll call the hello, Mr. Surgeon. We have a patient who has a hematoma. Yes, coming down now. Coming down now, yes.
We're going to do a lot more for this patient. Akma, over patient.
So the orthopedic surgeons are still not here. What will you do?
I'll call my team leader. Informing the orthopedic surgeon. I'll call the orthopedic surgeon myself again.
1, 2, 3.
Okay, any bleeding at the
So
scalp?
I'll try to stabilize the patient and I'll
Any start bleeding?
No, just a blood stain.
Next, any step deformity along the
There's no
spine?
deformity.
Okay, how about anatomy?
Neonatal is present.
Okay, okay. Any bony prominent, any blood, any bony mass?
There's no blood, there's no bony prominence.
Okay. Ahmad, take over. Okay, now we do the vital sign for this patient. How's the SpO2 of this patient?
The SpO2 is 95%.
BP?
BP is 100 over 70.
Heart rate?
Hari is 110.
The second patient? Better.
Primary survey is how to assess from every breathing, saturation, disability, and exposure. So airway is because we want to see how is the airway, whether airway is patent, is there any obstruction, airway obstruction. If the patient is any intubation, we have to intervene immediately.
So what do you mean by primary survey again?
Primary survey is a survey that we done to the trauma patient to determine to find the life-threatening causes.
Meaning?
You want me to name all the life-threatening conditions? Upper airway obstruction, tension pneumothorax, open chest wound or open pneumothorax, massive hemothorax, flail chest, and cardiac component.